G'day. Thanks everyone for coming tonight. My name's Rob. I'm a doctor and I'm the founder of MedApps. And I'm standing in front of you today because 10 years ago when I finished medical school, first walked onto the floor of the hospital as a doctor, I made a mistake and stuffed up. I'd just walked onto the ward. My consultant asked me to order a CT scan for a patient and thought I'd done it. Came in the next day, I'd made a mistake. As a result of that mistake, the patient's entire journey was delayed by an entire bed day, which costs the health system $2,000. I'd increased their risk of a hospital-acquired complication, and I'd added to the workload of myself and my colleagues. And even though I just sat in a week of lectures and I'd received a 120-page booklet of how the hospital worked and all the things I was meant to remember, I'd still made the mistake. And a hospital is a particular type of workplace. It's not like most other workplaces. You don't just start one job. You start a different job usually every 10 to 12 weeks in either the same hospital or a different hospital. And looking at this complexity and the way that it's managed practically inspired me to take some action. And MedApp is the result. So our philosophy at MedApps is that really it all starts with orientation. And this is straight out of the corporate HR playbook. If you can improve clinician orientation, you can improve clinician engagement, and you can improve clinician retention. And this is actually particularly important right now in the Australian health system, as we've, particularly in the wake of COVID, we're seeing an increasing in the casualisation of the workforce, the importance of hospitals trying to retain their clinical staff, but also the need to rapidly orientate agency and locum doctors. So what is MedApp? MedApp is effectively a cross between Enboarder and Culture Amp for hospitals. So we improve hospital efficiency, we improve their culture, and we do this while making life easier for the clinicians inside it. On a practical level, I'll give you a little example. So several years ago, I went out to Broken Hill to work in their emergency department as a locum. They're a user of MedApp, so they sent me a SMS, the text message on the side to load me into the app. The first thing I see is what we call a welcome mail out. So this is a personalized document. It tells me, for me, it said, "Dear Rob, welcome to Far Western Local Health District. Here's how you get from the airport to the hospital. Here's where you pick up your key. Here's how you transfer someone to Royal Adelaide. This is the team you're going to be working with in the hospital. This is the radiology hours." So I had the confidence the moment I walked into the doors that I knew exactly what and how I was walking into and making my life easier, but also meaning that I was giving a better patient experience. And it's not just for me. There's an administrative dashboard for the users, of course, so they can see that I've actually engaged and read this information, which helps them with their audit trails and accreditation. They can also use that to communicate with me further, so send out pulse check surveys if I'm a regular employee in the hospital, or work out how my experience was so they can engage in improvement. We're currently implemented in 80 hospitals across Australia, New Zealand and the UK, not just in medicine, but across nursing and allied health workforces as well. We have over 8,000 monthly active users, and through using the platform to deliver quality improvement projects, we've delivered over $50 million of efficiencies for hospitals.